Hi, this is Dr. Mary Kathleen Figaro coming to you from the Thyroid Channel. As always, if you have specific questions, please discuss with an endocrinologist. Today, we'll be talking about the aftermath of hyperthyroidism. Hyperthyroidism is an enormous burden on your body. No matter how you choose to be treated, either with methimazole or surgery or with radioactive iodine, you will face consequences of hyperthyroidism. There are three main consequences to hyperthyroidism, and they are to your muscles, to your nerves, and to your reproductive system. Let's start first with the complications to your nerves. Nerves are notoriously difficult to control. They have needs for many minerals and very many vitamins, and they are likely to be injured when you have any kind of nutritional deficiency. And hyperthyroidism can cause you to have loose stools and multiple stools, and as a result of your multiple stools, you may lose a lot of minerals. In addition, there are things that happen with your diet with hyperthyroidism or with your GI tract that would make it hard for you to absorb certain minerals. And often you'll see high calcium with hyperthyroidism, low vitamin D with hyperthyroidism, and low magnesium. And so you wouldn't be surprised that after hyperthyroidism, no matter the treatment, that your nerves have taken a toll and have had deficiencies and have had limitations. So it's very important to consider how you might improve your nerve function, making sure that you're well supplemented by the way that you eat, foods that are high in magnesium and selenium and chromium and zinc, as well as in vitamin D and calcium. And I think also it's important to learn that magnesium is a soother for nerves, and that if your sleep has been disturbed with hyperthyroidism, sometimes magnesium supplementation can be of help. The second consequence of hyperthyroidism that may affect you is injury to your muscles. Muscles are wasted during hyperthyroidism when your thyroid levels are high in your body. And that includes skeletal muscle, cardiac muscle, every kind of muscle you have in your body is affected, and every place in your body the muscles are affected by hyperthyroidism. Even if it's the first time you're having hyperthyroidism and you have a lot of weight loss, you've lost muscle proportionately to a greater extent than you've lost fat. And that has a lot of consequences. If you are recovering from hyperthyroidism, it's very important that you train your muscles, that you do muscle training, body weight exercises. You can use weights if you'd like. You can employ a trainer if you need some help and some support. But your muscles need to be redeveloped because they have lost a lot of function and have been wasted in the state of too much thyroid in your blood. The last consequences are to your fertility. No matter what treatment for hyperthyroidism you choose, your fertility is impacted. If you choose radioactive iodine, you can learn from whoever administered the treatment how long you should wait until you get pregnant. If you're on methimazole, there are limits to pregnancy that you should investigate with the prescriber. And lastly, if you have thyroid surgery, you must recover and have normal thyroid function before you are fertile and before you're able to have a good outcome for pregnancy. In summary, hyperthyroidism has many complications to the nerves and muscles and to your fertility. And I hope today I've given you some information that's helpful to you to discover how you might recover fully from hyperthyroidism.